your email address. There's no guarantees that you'll receive a certificate of attendance with CEU attached. So my name is Ruth Schwendinger. We've got a few more people joining from the waiting room. So I get to work with Prevention Network, and I want to thank everybody for joining us tonight. I do invite you to turn your cameras on. This is going to be one of those that is critical for you to be more involved. And so, Marcel, I hope your microphone's working tonight. It is?
Yep.
Excellent. And so I do want to encourage everybody to really be more engaged, because we're going to practice having conversations, and I'm going to ask you to do role playing. So get your anxiety out of the way right now. We will not be recording that part. So our focus tonight is on building trust. And as we're talking about that, what we need to remember is that we're all coming from a different place. And got a few more people joining from the waiting room. So we're all coming from a different place. And so I'm going to ask you to engage in a little bit of dialogue right up front, so that we can kind of set the stage. I don't know about anybody else, but I've been sitting in this chair for hours today. And it's been a long week already. So I just want to encourage everybody to take a breath, control that exhale. As we're talking about this, I'm going to invite you to share, take 10 seconds. And I want you to tell me in the chat box or unmute yourself, where were you 5 years ago? And I'm doing this so that we can understand and get a little more perspective on where we're coming from. So for me, 5 years ago, I had just moved to the Thumb of Michigan from the Omaha area of Nebraska. I was looking for work and volunteering at a local area business that worked with young people with autism. And that's where I was 5 years ago. So I want to invite anybody else to share. Go ahead and unmute yourself or share in the chat.
Um, 5 years ago, I was working as a certified nurse aide in a long-term care facility and just beginning my studies for my undergrad in public health.
Thank you, Allison, for sharing.
I'll go. I was just going back to school at Open University after taking a 20-some year hiatus to finish my degree as a single mom. Yeah, so I was just getting back into classes in the spring of 2017.
Okay.
I was 5 years ago, I was in a totally different industry, more in the corporate business world, advertising.
Okay. Thank you for sharing.
I'll go. 5 years ago, I was in my 11th year working for the Girl Scouts, and I had my daughter, she was 1, so I was part-time at the time.
Okay.
5 years ago, I just started working in our prevention department and getting trained in mental health first aid. And I had 1 grandchild, and now I have 6.
5 years ago, I was still living in Northern Michigan, and I had just started my part-time job working as the coordinator for the Benzie County Human Services Collaborative, just working part-time and with busy young children.
And Addison shared fire up chips. So I was just checking the chat. Do you want to say anything more about that?
Sure. I just feel like time has gone by really fast, and it's crazy to me how fast my college career went by. It was all in public relations and communications. So I'm still learning a lot about the substance use prevention field, and I really enjoyed getting to know all of you guys and everyone that we've been helping within our community. So it's been a great experience, and I'm surprised how much I've learned and grown in such a short period of time.
Okay. Angelise and Adrian, we're sharing just in 10 seconds or less, where were you 5 years ago? And for anybody else who recently joined, I want to invite you to put your name and your email address in the chat box, please, and thank you. So if anybody else would like to share. Okay. So 5 years ago, I was a junior in high school. It helps us build a little more perspective, and recently graduated undergrad. Okay. And I just want to invite you, I don't stand on ceremony, so if you have something to say, please do jump right in. This works a lot better when it's a dialogue, and it'll help keep the energy up a little bit too. So I'm going to move on. One of the things we haven't been doing very well with these is being interactional. And so my next question here is, what is your current priority in life? And so I like to use the 8 dimensions of wellness. It's a SAMHSA tool that we can use. And if, like me, your Zoom window is covering one side of the screen or other, you might have to click and drag that your screen around. But I want you to open up your meeting controls, which would be the same button where you find your mute. And you open up that bar and select annotate. And go ahead and interact with the screen share at this point. And I want you to use the annotate button, which will open up a new, it'll open up a new toolbar. And then we're going to use the fifth button in, which is a stamp. And you can choose whatever stamp you want. There's arrows and check boxes. And I want to invite you to use that. And then draw or add something to the slide that we're sharing right now. And stamp what is currently a priority in your life. Because not only are we coming from significantly different backgrounds, we also have a different priority. We also have a different focus. And so for me, that's important. And you can absolutely choose more than one.
Struggling to find out where I'm doing this. Sorry.
Okay, so
Me
if you can
too.
open up your meeting controls or wherever it is that you would usually find your mute button, that would be your meeting controls. And sometimes it'll be in the 3 dots more, but usually it's its own button called annotate. So we're using that, which when you click on it will open a new toolbar.
Let's see it.
And that new toolbar has things like mouse, select, text, draw, stamp. I want to encourage you to use the stamp and choose one of those that you can use. So it looks like we've got a good smattering here of different things that we're focused on as individuals. So good job navigating that new tool that we haven't used in the workshops before. There's only one person here focused on social, which for me is kind of important, and I've been missing out on because we moved again. And just kind of developing friendships and relationships with other people during COVID-19 has been especially hard. And so there's a lot of people focused on occupational and a lot of people focused on emotional, and an equal number on physical here. So I think that's really interesting. And I just wanted to use this as a moment to recognize that we are coming from different places. And when we're talking about prevention, in the bigger scheme of things, our best resource, our best tool is each other. The core of prevention is in relationships. And when we're talking about building trust in relationships, we need to recognize those differences that we all are coming from different backgrounds. A lot of people focused on schooling when they talked about where they were 5 years ago. But we also have different priorities, different focus in life, and different agendas. Everybody comes with their own agenda. So I thank you for participating just in that little activity with me. If you want to know more about the 8 dimensions of wellness, you can use this as a tool to really identify a focus area for yourself personally and work on that and it'll help you set goals. Just go to samhsa.com and you can learn more about the 8 dimensions of wellness there. All right, so we are going to clear the annotations for this next slide, even though it looks like confetti and it's kind of fun. I want to ask everybody, if you would, to help define prevention. So we have some people who've been in this field for quite a while. I've been doing this for 5 years with community level prevention and for about 15 years total. And so when we're talking about defining prevention, it's important also that when we're doing this, that we use language that is similar for everybody. And when we're talking about building trust, a lot of the problems we have in reaching hard to reach populations is because of language, because of a difference in understanding of what we're talking about. And so I don't want anybody to be driven away by this, but this is another time to unmute yourself. And I want to encourage you to, sorry, I'm gonna pull up a whiteboard here. I want to encourage you to unmute yourself, share in the chat if that's what you're more comfortable with, and talk about what does prevention mean to you.
I would say like stopping bad behaviors before they start.
I would say it's positive alternatives to potentially negative behaviors.
Okay.
It's education, community education.
Yeah, I would say like bringing awareness in a way as well.
Bringing awareness. What was the last part?
Oh no, I just said I'm bringing awareness as well.
Okay, in a way, I think is what I heard.
Okay.
Okay.
I would say like proactive measures to mitigate or eliminate problems.
Okay. And yeah, we're just very generally talking about this. Can you all see the whiteboard that I'm sharing?
Mhm.
Okay.
Yes.
I didn't want to be wasting your time with this.
I would say providing our community with the tools that they need to cope with and overcome the challenges that they will inevitably face in our life.
Okay.
I
would
once
add-
heard someone say prevention is power, and I liked that.
That is definitely worth 2 capital P's. Okay.
I was going to add building resilience to ensure healthy behaviors.
Okay. Just like in mental health first aid, spelling doesn't count when we're using whiteboards. For anybody who's sitting there judging me, I think I've got most of it right, but we're good here, okay? Yeah, so I'm going to say a delay in the onset of substance use. So if we can delay or prevent, I'm gonna add that. And that I'm using circular definition here, using prevent in the definition of prevention. But when we're talking about substance misuse, it really is that delay or prevention of the onset of substance use. Because we know the longer of a delay we can help people choose for themselves, the less likely they are to develop a substance misuse disorder. When we're talking about stopping bad behaviors before they start, yes, absolutely. Community education, awareness, providing our community with the tools they need to cope with inevitable challenges they will face in life. Positive alternatives to potentially negative behaviors. I wonder if the person who said that can unpack that a little bit more for us.
Yeah, for example, like I was thinking about the Botvin Life Skills series that we offer within my coalition and how that just teaches like, potentially more effective and less harmful ways to like deal with things like negative emotions. So like teaching ways to safely like decompress from anger or stress instead of maybe like coping with it through like maybe using a substance or something like that. So in that way, I was thinking like we're offering some like more positive alternatives to using substances.
Okay.
It kind of reminded me of like harm reduction when you said that one.
Okay. And for me, harm reduction is an important part of the spectrum of substance misuse prevention, treatment, recovery, harm reduction. But it's separate from prevention. And so that's an important distinction to make too, I think. Anything else, other comments or thoughts on this? Okay, just kind of want to give everybody the opportunity to share their definitions there a little bit. When we're talking about prevention in general, one of the basic tools that we're using in this series and kind of throughout the state for the last 15 years has been the strategic prevention or the strategic planning framework. It started out just as the strategic prevention framework, and people found it so incredibly useful they started using it in other areas of work. And so it's sometimes referred to this way and sometimes referred to as the planning framework. But when we're looking at this, there are several distinct phases and there are certain parts of it that are ongoing. And so typically the initial phase when we're talking about the strategic prevention framework is assessment. And so today I want to talk about and really zero in on why is trust and building trust so important when we're doing this assessment phase. And a lot of this we're taking in the context of cultural competency. And so without having to do another definitions exercise, what are some of the elements of culture that we need to pay attention to? And go ahead and just shout them out, drop them in the chat box if you'd like, and I'll read them out loud. What are the elements of culture?
Language.
Language. Customs.
Mannerisms and like body language.
Food, mannerisms, yeah. The way in which we communicate sometimes is body language. Sometimes it's personal space. Sometimes a religion is a part of our culture because it's a basic part of our belief system. Our beliefs, our norms, our values. Absolutely, Lori.
History.
Addison, that is a great point. What topics are taboo? In some cultures, there are things we don't speak of. Absolutely. Marcel, did you say history?
Yeah.
Okay, yeah. Our history of how do we relate with other people, just our history of what we've survived. And culture really can be looked at with a very narrow scope or a very broad scope. How we dress, the values, our belief systems, right? How we communicate, those things in ways in which we express ourselves. Yes. So when we're talking about within the context of cultural competence, we want to build trust, and we build trust with basic respect and developing an understanding with other people. And so when we're talking about this, I'm not going to teach you anything new. My goal tonight is to remind you of the ways in which we build trust, because it's not a new concept. It really is one of those things that we're going to look at through the lens of the strategic prevention framework and practice having some of those conversations, if you're all willing to participate with me. So when we're talking about the assessment phase in a specific community, so think of your own community, why would having trust, having people trust you and your organization and yourself in your role with prevention, why is that so important in the assessment phase? I probably won't tell you you're wrong.
I think it's important because it's the foundation that you build upon from that point forward when you're working with people.
So in the assessment phase, yes. In the assessment phase, we're trying to figure out what the main issues are. What is it that we have the power to address? What do we have the capacity to address as far as what is our community ready to address? And what are those issues that have the most severe impact? And so if there are taboo subjects that are having a serious impact on our community members, but we're not able to address those, then in that assessment phase, if we have the trust of a few key individuals, we can successfully identify what that is and identify the level of community readiness. So oftentimes during that phase, we're not trying to figure out what programs are going to be important to implement. At that phase, we're really just trying to figure out what's the issue. What are those things that we have the power to impact in our community? And I'm just going to stop and look in the chat here. So Addison, if it's teens, they may be worried to tell adults they use substances if they think they will be punished. Just an idea, not sure. Yes. One of the best trainings that we had a coalition member attend was for medical practitioners to learn how to do some motivational interviewing with young people around substance misuse and their own substance use. And so absolutely, that's an issue. Paige, did you have your hand up?
I was just going to say something. We talk about trust. I struggle within my community because there was distrust many years ago. What happened between, I guess, some organizations, and I still don't understand really why they are so closed door to me. But it built up a big wall, and it's taken quite a bit to knock some of it down.
Mm-hmm.
So you talk about trying to find assessment or trust building assessment, just even opening doors to me has been very difficult. So trust is so vital.
When you're doing that community assessment, that's another type of history that Marcel mentioned history earlier. That's another type of history. Does the people that you are trying to interact with have a history already with the service providers like what you're trying to provide? Lori.
I was going to say for buy-in, you need trust. If you're going to start initiatives in the community, you want people to, go along and cooperate with them, and, just they need to trust you in order to do that.
Mm-hmm. Yeah, if you want community buy-in, if you want people to get behind what you're proposing. And that's why it's so critically important to involve the people who are receiving services, and I'm going to say that, and it's not the right term, it's not the right framework for what we're trying to do here when we're working on community capacity building, when we're working on health promotion. But when we're talking about getting community buy-in, absolutely, we need to have that name recognition, we need to have that trust in what we represent. And a lot of the other workshops we've talked about, communication planning and branding and communication with people that is consistent with your values. And so we were going to talk tonight a little bit about the language that we use. Did somebody else have a hand up? Okay. But absolutely, we need to have trust developed during that assessment phase, because if we don't, we're not going to be able to correctly identify what it is that needs action. And when we're unified in identifying our goals, and we have that community buy-in that Lori mentioned, then we're starting to build momentum. And everything that we're doing is building towards momentum in the community. We want to build ownership in the community about their own health and wellness, right? And so we're shifting things away from the disease model and away from providing service. And that's why I said earlier, that's not the right word to be using in this framework, because we don't want to be focused using the disease model of addiction. We don't want to be focused on what's wrong with you. We're going to come in and fix it with our programs and policies and practices. What we want to focus on is empowering individuals to take ownership of their own health and wellness and to promote that in their own communities. And so the best way we can do that is by developing some of those trusting relationships. At the beginning of the workshop tonight, I asked about what you were doing 5 years ago. When we're talking about trust and building trust, it takes time. Very few of us were in our current role 5 years ago. I think, Sarah, you said you were. Kelly, you had just started yours. And I think that's it. Out of the 10 of us, 15 of us that are here tonight. 2 people were in the same role 5 years ago. And so when we're talking about building trust, it works a lot better when we have somebody who is already a member of that part of the community that we're trying to reach, that's willing to help us bridge that gap. And in our podcast this month, I visited with Ricardo Bowden and Anna Winters about how did they navigate working with the Saginaw Chippewa tribal Indian community, the Ojibwe people. And Anna is the tribal coordinator for Peer 360. One of the things that she was able to do with the recovery community is to help bridge that gap. So find people in the community where you have shared values, where you have shared goals, and introduce yourself. So if you don't have this trust already, don't expect it to develop overnight, but do get started right away. So identify those people who are already part of the community that you're trying to reach, where you have shared goals and values. And a lot of that is going to happen just through identifying those people and then having those conversations that may be uncomfortable. So my next question here is, why is trust important during the capacity building phase? And we're kind of transitioning into that when we identify potential partners. Why is trust so important there? Because when we're asking for people to work with us, we're asking for their treasures, their time, their talents, their resources. We're asking them to invest in a shared vision of the future. And so if we're asking for things from them, I'm just going to answer this one ourselves, by myself, is trust is important so that they would be willing to give us those things. So I'm going to pause for just a moment. And I want to welcome Ricardo Bowden, who's just joined us. Ricardo was on another training for the state earlier and was just now able to join us. But Ricardo is, let's see, I think I have your bio here. So Ricardo is the executive director of Peer 360 Recovery Alliance, serving many counties in the state of Michigan. He's also a self-employed independent contractor providing a variety of substance use disorder related services, including counseling at List Psychological Services in Bay City. He does peer support counseling at Michigan Rehabilitation Services. He does motivational speaking in public schools and on college campuses about HIV and STD prevention. Mr. Bowden has been a volunteer and a professional provider of HIV and STD related services for the past 20 years. 26 is what my paper says. Received his Bachelor of Arts in Urban Studies and his master's degree in public administration, both from Michigan State University. He holds international and Michigan Certification Board for Addictions professional certifications as a prevention consultant, as an addictions counselor, and as a peer recovery mentor. He's received training as a recovery coach by the Connecticut Community for Addictions Recovery, and he trains recovery coaches and other SUD professionals. He's a member of the state team to implement the Michigan Certified Peer Recovery Coach training. And as a person in long-term recovery, he's been a friend of mine for the last 5 years, right? So Ricardo, I just wanted to introduce you and ask you to say hi to everybody if you're still here.
Well, hello. And good afternoon. Right now I'm just saying hi, I hope. I literally just finished the other meeting and jumped on here. I thought wasn't aware that everybody's going to be here already like this. So taking a little bit of that, and I have not gone to the restroom yet. So I'm going to do that. I'll be right back. I mean, I literally went from one to the other. Does Anna know she wanted her here now? But we had a message about being here by 4:55.
So Anna's not here yet. If you could message her and we'll talk to you again in a little bit. So thank you.
Right back. Thank you.
Anna and Ricardo joined me during the conversation about how they had been successful in building trust within the Native American peoples group of the Ojibwe tribe in Saginaw. And so one of the things that we talked about during the podcast was building trust, and how they did that was really just coming in with humility. As Kelly said earlier, it really, trust develops over time when you come in with humility, when you come in with the understanding that I don't have a solution for you. I can empathize and you can help me identify the problem or issues or strengths of your existing community, and we can build on that. And Anna, who will be joining us shortly, really enjoys focusing on the strengths of situations and walking into a room or working with a group of people and highlighting those strengths. And so that's a really refreshing way to look at prevention. So the next question here is going to continue around the wheel when we're talking about the strategic prevention framework and building trust. Why is it important during the planning phase? The planning phase is when we identify what tools we're going to use to address the issues of strengths or weaknesses that really are having a significant impact on our community, as well as identifying those tools, as well as figuring out how we're going to implement those tools and how we will evaluate and sustain those potential outcomes. So what are your thoughts on this as far as why is trust important during the planning phase?
I would say trust is really important because during that phase, you're relying on your partners to help guide and to work together to implement whatever program or design you've created.
I agree. I think that it's really about communication at that point. When we're talking about what is the importance of trust in the planning phase of prevention, we really need to be able to communicate well. And so when we come in and we're able to use language that is understood and shared and inclusive, then we're able to communicate more clearly, more quickly about what's needed. And it really is about making it a collaborative process so that when we have trust, if someone disagrees with something or has an opinion of, well, that's not going to work in our community because, like Paige said, we've had bad experiences with people doing that in the past. If they don't feel like they can trust you and give you the truth, and you wouldn't be able to take that truth with humility, with a grain of salt and understanding, then we're really not going to be able to move very far in the planning phase. Does that make sense? I'm seeing some nodding heads. So what are your thoughts on that as far as the importance of trust in the planning phase? Do you have other experiences? Maybe I'm asking the wrong question.
I think trust is important because it kind of goes to the integrity of what you're building, and it forms an effective team. Without that, everybody's kind of the me mentality instead of the big picture.
Yeah, because we are working on a collaborative effort. We are working on a community effort. And if everybody doesn't feel like they're involved in the planning phase, then they don't have that buy-in that Lori mentioned earlier. Right? So we need to elevate the voices of people who have been historically underserved and recognize that their experience is valuable, their knowledge is valuable. They know how to communicate better than we do with the people that they interact with on a daily basis. So Anna has just joined us. Anna, I want to take a moment to say hello. Welcome. Anna Winters is the tribal coordinator for Peer 360 with the Saginaw Chippewa Indian tribe with the Ojibwe people. And so I wanted to take a moment to say hello and welcome and ask you if you would like to just say hi to the people in the meeting right now.
Yeah, thank you so much, Ruth. Hey, everybody, I'm Anna. I am the Isabella Tribal Community Coordinator for Peer 360, and I live here in Mount Pleasant, Michigan, and I work with the side by side in partnership with the Saginaw Chippewa tribe of Indians. I myself am Native American. I'm Ojibwe, a member of a federally recognized tribe from Wisconsin. But yeah, and I'm very open to any questions or anything. So thanks for having me here.
Great. Thank you for joining us. So in a moment of humility, I need to recognize for everybody that I gave Ricardo and Anna the wrong time to join the call. So I said 4:55 and I should have said 3:55. So that's entirely my fault, and I appreciate their grace while I practice humility. So we're just talking a little bit about humility and grace and defining the role of trust in different steps of different phases of prevention in the strategic prevention framework, which is the core of what we're working through with these capacity building workshops. And how do we do prevention effectively in communities where we historically have not had trust? And whether that trust comes from cultural differences or from language barriers and misunderstandings due to that, or a history of abuse. We want to recognize that it's important to build trust effectively throughout the entire strategic planning framework, Because if we don't, in the assessment phase, just as a quick recap, we're not going to be able to adequately identify what the community needs are, what the community readiness is. During the capacity building phase, we're not going to be able to develop that community buy-in and ownership of the strengths or issues that we're trying to address. During the planning phase, we're not going to have good communication. We won't be able to identify potential barriers. We'll just encounter them later without knowing that they were going to be there because we didn't have good communication, because we didn't have trust. So my last question here, why is trust important to sustainability? And sustainability is a part of the strategic prevention framework, along with cultural competence, that we should be considering the entire time. When we're talking about sustainability, we're looking at prolonged improvements in the overall health and well-being of our community. That doesn't necessarily mean funding. It doesn't necessarily mean programs. We're looking at health and wellness. So when we're looking at sustainability and making that an integral part of our process with prevention, why is trust important? Why do you think trust would be important in sustainability?
In the strategic planning framework, it seems like every step, builds off the last one. So if we don't have trust throughout this entire process, it's not going to be a good fit for the community. And once, the coalition or any prevention specialist stops directly interacting with the community, if that programming is not a good fit for that community, it's just going to fizzle out. It's not going to naturally integrate into that community. So to develop a good relationship throughout this whole process, you need to have trust, because that's what really good relationships are built off of. So if the community doesn't trust you, you're not going to have a good relationship, which means you're not going to get good feedback throughout the process. And then ultimately, they're not going to continue that plan if it's not a good fit for their community.
And there's different types of fit. When we're talking about the strategic planning framework, we're talking about conceptual fit. We're talking about, is it something that we can practically do? So yeah, there's different types of fit there. Anybody else? Absolutely. Great response, Addison.
I was just going to say, I think when you're planning for the long haul and you want to do some long-term initiatives, you need to know that that your partners are going to be there for it. And, just that they're going to be cooperative, throughout the process and not just kind of a one-time thing.
Mm-hmm. And Ricardo, you raised your hand, but we're really just jumping in and shouting things out. So go ahead.
Okay. Speaking specifically from the perspective of being engaged with communities of color and other communities that have been historically underserved. I can share with you as an African-American person, I start with, I don't trust the mainstream folk. I was taught not to trust that. They've been, not only because of history, but because of things that continue to go on. And so I'm coming with, I may be foolish for even trying to trust you. So, so for people who are taking the risk to trust other people coming to their community, for instance, as we work in the tribal community, for instance, one of the conversations I had earlier on with a person who worked there for a long time and really insightful and helped us along was they were involved with another treatment provider. That provider, for reasons that were totally reasonable, left the community. When they left the community, they did not communicate the why. They had made some agreements about helping, being available to the tribal community, having beds available for people from tribal community, and then now all that went away and they were gone. And that left a train of deepened mistrust. And what was explained to me, when you think in the Native American community, if you think about the history of treaties being made and agreements being made with the Native American community, literally 100% of those treaties were reneged on, and that the mainstream folk broke those treaties. And so over and over and over and over and over, it was taught. People tried to trust, then trust was broken. Try it again, trust was broken. And so it's realistic then for individuals who had that experience to come from a place where I can't trust you. You show me over and over again, I can't trust you. Now, it may not be you particularly, but the mainstream community, different faces, different voices at different times. So it's very, very easy to destroy that very quickly. And so being real consistent all the time, doing what you say you're going to do, is something we've really worked hard at 5060 in the tribal community. When we ran out of resources for a while and didn't have the funds that we had hoped to have to sustain, we found different funds just to, in that gap, be sure that we weren't going to have a gap in services and move away, because we understand that historical dynamic. So just a comment about trust. And when people don't expect they can trust you, they're hypersensitive to that. It's important for us to be aware of that when we go in different communities, particularly underserved populations and those who've been on the short end of the stick for so long and so often.
Thank you for that, Ricardo. Thank you for sharing that. One of the things that your comments brought to my mind was when we're talking about behavioral modification, and I come from a background in psychology. I have 2 children of my own. I worked with youth for the last 20 years, 5 of that was volunteering. But when we're looking at behavioral modification, consistency is key. And so when we're talking about being able to sustain the outcomes that we're trying to develop in our communities, when we have such high turnover in staff, when we consistently are introducing new people to the table, that's a problem. Because we're always on step 1. We don't expect everybody to be there for us. If we are willing to share a need with them, there's no expectation that that group or that organization is still going to be there 6 months from now. Again, I asked you where you were 5 years ago when we started this meeting. 2 of us were where we are now. We need to build up our prevention providers. We need to create a better supported network of training, of technical assistance, of networking, so that people are able to do the jobs that they were hired to do, so that they can stay in place, so they can build that trust in our communities. And that's kind of the heart of Prevention Network, is we're trying to really help people bridge that gap between the different silos where we're all working. Because we have to have trust. We have to develop relationships with people in order to be effective at prevention. We have to stop having 6 months at a job and then rotate somebody else through. It's a terrible waste of resources, of our time, of our funding, and of the time of the people in our communities. So trust is incredibly important, and we as prevention workers and people working in the field of substance misuse prevention, mental health services, health promotion, we need to do better. And so when we talk about sustainability, I'm also talking about you in your role. How are you going to stay in that role? How are you going to grow and continue to develop your prevention skills, your knowledge, your abilities to facilitate groups and things like that? So I want to recognize that you need to have trust in yourself, that you can do this job, that there are people in your corner that are there to back you up and support you as you continue to grow through this process. And so sustainability is not just about community programs and outreach. It's about you as an individual. How are you going to keep doing what you're doing without burning out, without changing careers? How are you doing? And so that's an important part of it. And I said that was my last question on this slide. I was going to shift gears at this point and use this to launch us into our next section where we just have dialogue with Ricardo and Anna about their experiences. But I want to ask you these questions and let this sit with you for a minute. Because in my mind, these two questions are going to give you the same answers. Who is it in your community that's at higher risk of developing mental health or substance misuse disorders? Who are you uncomfortable addressing? And for me, oftentimes that's going to give you the same answer. And so I'm making it personal because, as I said, prevention is all about relationships. And I don't want you to feel uncomfortable when you're talking with people in your community about substance use. I don't want you to feel uncomfortable when you're talking with people in your community about health promotion, about wellness, and how they can take ownership of their own well-being, how they can take ownership of programs that are being effectively run in your communities. So who is it in your community? And I'm going to ask you to use the chat function, but change the setting from everyone to just me. Just share that with me. Who is it that you're uncomfortable talking with and sharing with? So while you're doing that, I want to share a couple of resources that specifically are targeted at helping us with the language, that are targeted at helping us be able to better address certain subsets in our community. And I need to mention this caveat here. No one person is a representative of an entire community group. We've talked about the importance of relationships and making this personal and recognizing the value of the individual and the strengths therein. So your best source of information about how to communicate with a person is that person. And so Anna and Ricardo really focus on humility in their conversations with me when we're talking about this in the podcast. And so it's okay to not know the right words. It's okay to stumble over yourself and ask for their pardon if you say things in a way that didn't come out quite right. When you're talking about people who specify pronouns that may or may not align with their gender at birth, there's a really great resource called pronouns.org that can walk you through reasons of why people use different pronouns, what's important about it, and how to use those effectively in your own communication. When you're talking with people who have a personal or a family history of substance use disorder, there's a great resource that was created with the Region 5 Prevention Collaborative Group, shared on the Peer 360 recovery page, called Chances Are. And it really focuses on the language that we can use around addiction and substance use that is not stigmatizing. Some of the other things I want you to think about and consider as we're talking about uncomfortable conversations is people from a different generation than you. So when we're talking about people from the greatest generation, they grew up in a time where any conversation about mental health was taboo. We're talking about people who grew up in the 70s and 60s. We recognize that mental health institutions were a terrifying thing to consider. When we're talking about people who are students now in high school, they've grown up using language around anxiety and depression. But people in my generation still shy away when you use the word suicide. And so recognizing, as we're talking about culture, that our generational differences there. And it's okay, as long as we go in with that spirit of humility, to go in and have those conversations with people. You don't want to do it in a wide public forum, but again, find that individual who can help you bridge into that community and have that conversation with them. It is all about relationships. When we're talking about people who speak a different language, there are some great apps that we can use right now, but recognize that those are faulty. And so it really is best to go directly to the person that you would like to reach and have that conversation with them. And throughout that process, if you're going through interpretation, understand that there are certain words that don't translate well. There are certain topics that are taboo in others' cultures. When we're talking about people who've been incarcerated, again, they're individuals. They're people just like you and I. And when we have those conversations with them, make it personal, find that shared common ground, find those shared goals, and go from there. Recognize and value the differences in your backgrounds, in your history, in your experience. Honor those and build off of your shared common ground and go in with an open mind, open ears to learn. And that really is the best way to build trust with any individual or with group of people, is to go in and listen with them. And so that's what I have for you this evening. I do want to give Ricardo and Anna the opportunity to engage with you in dialogue about their experiences. So I am